Hello everyone. So today we shall be speaking about nutritional intervention in ovarian cancer patients. So before we go into that, let us understand what are ovaries. So yes, all of us know that ovaries are the reproductive glands. And so cancer is going to have an impact on the ovaries as well. So now there are different types of ovarian cancers, but in today's video I shall be mainly focusing on the nutritional intervention. Because of the in ovarian cancer it is very important to take the nutritional screening of the patients as well to understand if they're at a risk of malnutrition or not. What is the tests which are done for screening of ovarian cancer? Mainly when you visit a gynecologist, they will be doing a pap smear as well to understand if you are at a risk of developing ovarian cancer or not. Now, in most of the ovarian cancer patients, nutrition is going to be a very challenging role because most of these patients experience malnutrition. Now, chemotherapy is a common treatment for these patients, and because of the chemotherapy, they can experience certain side effects like abdominal pain, or there could be also peritoneal fluid accumulation as well. And you can also have bloating, and there could be other gastric discomfort which is experienced by such of the patients, which will again have an impact on their overall nutrition status as well. Generally, when we see these patients also have a reduced oral intake because of the various side effects or the symptoms which they experience because of the treatment or the medications which they are on. Also, one more thing to be considered is in the advanced ovarian cancer patients, they generally have peritoneal mets, which is also manifested by bloating, and there also could be loss of appetite, nausea, and which is going to have an impact on the nutritional intake as well. Now, in ovarian cancer, also what happens is there is buildup of fluid in the peritoneum or in the abdominal cavity. So generally what happens is that most of these patients tend to be having a feeling of fullness, or they just don't feel hungry. So during this time, it is very important to give them a salt restriction and a fluid restriction, because we need to ensure that when there is a water restriction, a fluid restriction as well, it is going to help in minimizing the accumulation of fluid in the body. Now, the concerned oncologist is going to evaluate how much of actually fluid accumulation will occur in the abdomen, and based on that itself, they are going to be helping you out as to what treatment has to be taken. Generally, for these patients, our main objective of the medical nutrition therapy is one, we need to ensure that we reduce weight loss in them, because again, malnutrition is going to occur in these patients because they experience loss of appetite and a reduced food intake as well. Next is to manage the side effects and the symptoms of the for these patients. As I had earlier mentioned, the common side effects or the symptoms which are generally seen in these patients will be nausea, vomiting, bloating sensation, or even a gastric discomfort, which could be constipation also. Now, in advanced ovarian cancers, it has been seen that they also experience a bowel obstruction as well. Now, a bowel obstruction, either it can be mild or be severe as well. What happens is that again it is going to have an impact on their nutritional intake. It is very important to take immediate medical attention if they are going to be having a bowel obstruction, because again this is going to lead to other gastric health issues, especially constipation as well. And also what happens is that it is also important to ensure that these patients get, we give them nutrient dense foods, and also we give them additional nutritional support with the help of oral nutrition supplement. So now, what are the dietary guidelines for these patients? First of all, we need to ensure that give, we give them adequate amount of proteins and energy which is required for them to withstand the treatment as well. Since they have already been experiencing loss of appetite, nausea, or bloating, we need to encourage them to have small, frequent meals in the diet which they can take. Basically, like 5 to 6 meals in a day is what they can give. Encourage them to have a soft diet which is easily digestible and their gut also gets rest. And also we need to look out if there is any fluid accumulation in the body, so that we need to give them a salt restriction or even a fluid restriction as well. Most importantly, due to water retention in them, we generally tend to restrict on the intake of gluten. Gluten is mainly present in wheat and it is a protein, and it can sometimes cause inflammation in these patients. So, to conclude, yes, diet plays a very important role in ovarian cancer patients. Most importantly, it is about managing the side effects and the symptoms, and also to work on improving their gut health. Thank you so much for watching my video. We at ZenOnco.io are here for your journey, and in case of assistance, you can surely reach out to our cancer coaches on the below mentioned contact number. Thank you.